All right, everyone. Good news. We've got Dr. Timothy Ryan, the director of the Clear Creek County Board of Health. Dr. Ryan, welcome to the show again.
Thanks, Mark. Thanks for having me.
So I know you just gave an update, but we'll have listeners for our rebroadcast of this, and I know it's going on your website as well. So let's give people a chance to hear those numbers again. How are we doing here locally and statewide?
So statewide, current number of cases has actually increased over the last 7 days. It's now in excess of 1,600 per day as a 7-day average. The 2-week cumulative incident rate also has gone up. It is now 416 per 100,000. Hospitalizations are holding steady, but that isn't saying much. Poudre Valley Hospital, as an example, up in Larimer County, has been at 100% capacity for the last 3 weeks running. And so, as you might imagine, the staff there is quite exhausted. But 45% of our ICU ventilators are in use, and over 87% of our hospital ICU beds are in use across the state. Close to 1,000 people currently hospitalized in the state of Colorado, and 83% of those are the unvaccinated. 2-week test positivity in the state is above 6.4%. The things driving the spread are the unvaccinated and lack of mask wearing. Across the state, we're about 69.4% of those eligible are fully vaccinated, which is good news, but that could be much higher. Here in Clear Creek County, similar trend. We've had 26 cases over the last 7 days, 50 over the last 2 weeks, for a sum total of 675. We've added additional hospitalization to our numbers now at 31, 4 fatalities. Our 2-week cumulative has dropped slightly, but it's still quite high at 513 per 100,000. Test positivity rate here in the county is at 9.4%, much higher than the state average. Driving these numbers, the unvaccinated, the unmasked, same story, different week. Fully immunized, we're now at 61.9% of the eligible population, so well below where we need to be, and a good explanation as to why we're seeing the spread that we are in the community.
Yeah, as we've said week after week, I see mask wearing in the community, in Safeway, at the gym. Those are my 2 places that I go, but it's not universal. And my expectation is everyone that I see without a mask is someone who is unvaccinated. So I try to stay away from them with my mask on. And I would encourage everyone to do the same. I wanted to get on a subject here that I've read some things about this, and I've kind of noticed it over time that we have these peaks in the caseload, both locally and nationally. And they seem to average around 2 months each. And we're on a trajectory for another 2 month or so average peak. But with the cold weather coming, I just don't know how to interpret that. Do you have any thoughts on that?
Yeah, I mean, this peak obviously started earlier than last year's. Last year started well into end of September, October. This was started several weeks earlier. So the numbers that we're seeing now, they don't seem to be slowing down and plateauing in any way. So it's really anybody's guess where this ends up. It could, as you pointed out, could get even worse given the cold weather that is on its way and driving people indoors even more so than they are now. And as we have seen historically over the entire time of this pandemic, cold weather, as it drives people in, will drive numbers up, and particularly those who are unvaccinated. So, I'm hoping there's an end in sight, but given the slow progress of the uptake of the vaccine, it seems to me like this is going to play itself out. So if you're out there unvaccinated, it is not a matter of if you get COVID. It is a matter of when. And if you want to be a part of the statistics that are in the hospital, now driving 83% of that population, then that's on you. But there is a free, life-saving, life-protecting vaccine out there that you can take and help slow the progress of this. But the longer we have this peak and the number of cases that we see now, the far more likely we are to see an additional variant come out of this. And I think that's one thing I think the unvaccinated don't fully understand and appreciate. They're the ones driving this pandemic at this point. 100% are being driven by them and the potential for a new variant. So we're all tired. We're tired of wearing masks. We're tired of socially distancing. We're tired of doing all of this. But we're now being held captive by the fact that half the population is still unvaccinated across the country, or less than half. But significant numbers to continue to drive this.
Yeah, I hate to even mention this, but we've all had an expectation that someday we with luck and hard work we could reach herd immunity. It's beginning to look like that might happen as the virus spreads like wildfire in the unvaccinated community. I mean, at a certain point, it's going to run out of potential hosts.
Yeah, it will, but there are still a significant number of hosts available for the virus, and this is the challenge, right? In our community alone, we have, only 62% roughly of our population is fully immunized. And unless you are fully immunized, you still are at the same risk as the unvaccinated moving forward. So, huge chunk of our population, both in this community, but more broadly in the state and even more broadly in the country. There's lots of people to go.
Yeah, I'd like to just add one thing to this conversation about the unvaccinated and their potential for a tragic outcome. We have had more deaths than the Civil War and World War II in the First World War combined. It's just an incredible number of people that have succumbed to the COVID virus, and it's going to continue until we can get something done about it. I don't know. Let's talk about something maybe a little more on the positive side. Pfizer this week has declared that their vaccine is safe and effective in pediatrics population, and there's an expectation that Moderna will have similar results in the next few weeks. What do you foresee as happening in that regard?
Yeah, great news. Not unexpected, given what we've already seen thus far with the vaccines. But great news, it suggests that they're going to be submitting that data any day in the next week or two, I would guess, to the FDA. And once they have it, hopefully they can turn that around rather quickly. So if I had to guess, it would be sometime early November before we're able to actually give doses to those in the 5 to 12-year-old range. But great news. It allows us potentially to have as many of those kids that fully vaccinated by the end of the year. And looking forward to that. We're ready. We are ready to give vaccines to any and every child that needs and wants one, with obviously their parents' approval. We're hoping that the uptake is significantly more than it is in the middle school, high school, which has been quite disappointing in terms of vaccine uptake there. We're doing what we can to inform and educate people with facts. Unfortunately, lots of people have consumed misinformation, and that's what's driving their behavior. So we are hopeful that here in the next several weeks, in month and a half or so, we'll be able to start disseminating vaccines to those under 12.
So I just heard you say that it's been a disappointing response with the 12 to 16-year-olds at the high school and middle school. I wonder what sort of efforts have been taken to inform and discuss the subject with those students.
Several things. Obviously, there's no shortage of information on our webpage and on our Facebook page connecting those as well as the town hall. But doing vaccine clinics at the school, we vaccinated 90% of the staff there on site at the middle school, high school. Also reached out to every single family several times with obviously the facts, offering that vaccine and readily available at the school. Uptake so far has been less than 35% of the student body in the middle school, high school is fully vaccinated. That's less than half of where it actually needs to be or where we would hope it to be, and significantly less than the broader community here in Clear Creek. So, it's one of the reasons and rationale for why we need to test the student athletes there twice a week and why the students need to be masked, as does the staff. If we were in the 90% range like we are with the staff, we'd be having a very different discussion. Masks would be something that we wouldn't be entertaining at this time in the testing regimen that we do. But the reality is far too few students, through their parents, have not opted for the vaccine, and so we're having to put other protective measures in place to keep the kids safe, and most importantly, in school.
I wanted to talk about testing in the school a little bit. I've been reading that there are school districts and universities also that have started testing with the antigen testing, the rapid test, that you can have a result in within an hour at the most. And I know that those aren't nearly as accurate as the PCR test. But if you're testing everyone and you're doing it very frequently, there's school districts that are hoping that they can keep children that are contacted with someone who's had a positive case, keep them from being isolated and missing 10 days or a couple weeks of school. I wonder if you have any thoughts about rapid testing versus, the PCR test and a strategy of isolating, quarantining those that might have been contacted.
Yeah, and one notable difference between the two populations, those in universities and colleges as an example, and those in high school. Most universities and colleges are mandating vaccines. So more than 90% of the student body, just for instance at Colorado State University, for which I'm most familiar, more than 90% of the student body and faculty are fully vaccinated. So that, in that population, using the antigen test makes sense. In a population where we have less than 35% of the student body vaccinated, it doesn't make as much sense. The risk potential for the vaccinated group warrants the use of the antibody test, right? The overall risk is generally much, much lower in the CSU population, for example, than the Clear Creek High School population, just because of the vaccine level in those two different populations. So antigen test is appropriate, particularly for that level of testing, the number of students and faculty, but also the number of people who are fully vaccinated.
Yeah, well, that makes sense. And I know that the federal government just put some funds forward in an executive order by the president, I think, for additional antigen testing. And I know that in Europe they do extensive antigen testing, but again, it's not nearly as accurate as the PCR test. But you do have an immediate result for what it's worth, and you could do it again the next day or even later in the day, the same day. I guess I'd like to move on to something else that's in the news, and that's the booster shots for those of us who have already received the, by the way, free vaccination and who are some months out from our vaccination date. Can you bring us up to date on what you know about boosters?
Absolutely. So last week, the FDA advisory group met and made the recommendation that 65 individuals who are 65 plus, in fact, get that booster shot. It's going to take, though, the full FDA to approve it. It is not yet approved. We've gotten several emails already regarding that, once the FDA approves it and gives us the green light, we'll be able to begin to administer those third doses. And the doses, just to be clear, whether it be Pfizer or Moderna, it's the same exact vaccine. You're getting just the third shot of it. There's nothing special about it. It's not a different formula. It's the same one. You're just getting a third dose of that. So as soon as the FDA gets full approval, we'll be rolling those out. And individuals who would like to get that third dose who fall into that 65-plus category can come to one of our Wednesday clinics that we're having here at the new facility, and we'll get you vaccinated.
Now, my understanding is that that there has been some reduction in the level of protection as time has gone on, but the vaccines are still supremely effective at keeping you alive and out of the hospital. But there are people, and it is a relatively a small number of people, but there are people who have had breakthrough cases, as to how they're defined, and those are a few days of mild symptoms. And the Pfizer seems to have its effectiveness has been reduced somewhat more than the Moderna. I wonder if you think the 3 weeks versus 4 weeks between the vaccination doses had an effect, or is that because they seem so similar, the Pfizer and Moderna? I wonder what the difference might be.
Yeah, there's a whole host of variables that could play a role in that. But to your point, Pfizer, Moderna, and J&J are highly effective at keeping you out of the hospital and or dying. As I stated earlier, only 17% of those in the hospital are the vaccinated. 83% are the unvaccinated. And keep in mind, individuals in that scenario, oftentimes they have underlying other health conditions, and or they're of significant age where no vaccine is going to be 100% effective, and no vaccine is going to potentially keep even the frailest of individuals from having to go to the hospital or dying. So for the vast majority of individuals, it's going to keep you out of the hospital. It's going to minimize any potential effect that COVID has on you. And to your point, it might be a couple of days of cold-like symptoms or allergy-like symptoms, and that's the worst of it.
I'd just like to pile on what you said about that small percentage of people who are vaccinated who are in the hospital. I think everyone needs to keep in mind that all of the most highly susceptible people to extreme adverse effects from the virus are vaccinated, and so those are the people who are the most susceptible. And if they get a breakthrough case, they're going to the hospital. If you're immunocompromised or one of those other horrible categories of folks who are susceptible to viruses. And I would also wanted to ask you about the flu vaccination. I got mine this past week. What do you think? Is it time for folks to get out there and get that free flu vaccination as well?
Absolutely. We began vaccinating with the flu vaccine last week or the week before. They are free and available at the clinic as well. We will offer them in conjunction with the COVID vaccine on our Wednesday clinics. And we're in the beginning stages of rolling that out. So yes, if you normally get a flu vaccine, I highly recommend you get one this year. Having that double protection against the flu and COVID is particularly important, particularly given the lack, to your point earlier, about mask wearing. I think mask wearing in the last 18 months has had a significant impact in a positive way on reducing the flu over the last 2 years. So as we put away our masks, it's even more important to get that vaccine against the flu. And it's never too early. We have them available. The Safeway pharmacy has them. Every pharmacy within 20 miles of here has them readily available. We provide them for free, and so happy to do that.
What about vaccines for hepatitis? Do you offer those as well?
We have a whole suite of vaccines that we have, Mark, from varicella, the Hep A, Hep B, the flu vaccine, COVID vaccine. We have a whole list of HPV vaccine as well. So a whole host of vaccines that we have readily available for the general public.
Well, that's good to know. And so if someone came for a COVID vaccination, they could make arrangements with you for any number of vaccines. Is that correct?
Absolutely. Yep.
Okay. Well, let's talk about the town hall that's coming up this week. That's on Thursday. Tell our listeners the details of how they can participate.
Yeah, so the town hall, as we have done for many, many months in the past, this time we are asking that folks submit their questions beforehand so that we have time to process them. We're getting lots and lots of questions, so it's really hard to answer every single question, and we're trying to make sure that the questions that we already have answers to up on our webpage, obviously we're not going to be answering those again. We'll point everyone to our website for those answers. But for new questions and ones that are unique that we haven't answered before and are not on our website, we'll be answering those. So the time is from 5 to 6 tomorrow evening. You can go to our webpage, Clear Creek County webpage, click on the COVID link, and on there, on the homepage for that is our monthly COVID Town Hall. It has all the information in terms of where you submit your questions to. It's both going to be on Zoom and on Facebook Live.
Well, that sounds like a great event, and I know that if you're not vaccinated and you want to remain anonymous, that's a great time to just get on there and on Facebook and listen in to the discussion, and maybe you'll have your questions answered or find out where those answers are available. So if you have questions, of course you can call Dr. Ryan's hotline number. Let's see, that number is, you know that number. I'll let you give it.
The COVID hotline number, yes. 1 second. COVID hotline number is 303-670-7528. That's 303-670-7528. And you can submit your questions to the Town Hall Questions at clearcreekcounty.us. That's Town Hall Questions, all one word, at clearcreekcounty.us.
Now, Dr. Ryan, just to confirm, that Town Hall is Thursday, September 23rd?
Correct, yes. Sorry if I said tomorrow. I had a few days off, so my sense of the calendar is a little skewed. No, it's this Thursday from 5 to 6 p.m.
I hope you enjoyed your days off. I'm sure you did. Let's see. The testing sites and times, I thought that you had anticipated Wednesday was going to be the Georgetown day, but evidently that's been changed to Monday?
Correct, yeah. So the testing, we finally got logistics figured out. Testing in Georgetown is on Mondays, and that is from 8 a.m. to 2 p.m. Similarly, you have to make an appointment just so they know how many people are coming and make sure they have enough spots. And it's at covidcheckcolorado.org. Also a link on our webpage to address or to connect to that. So the Idaho Springs is on Tuesdays and Thursdays from 8 to 2, and in Georgetown it is Mondays from 8 to 2. Starting next Monday is our first day in Georgetown.
So just to confirm, the location here in Idaho Springs is on east of the ball field on Minor Street. You go down that little ramp, and it's located right there in that little parking area next to the football field. And then in Georgetown, that empty lot by 11th Street along Argentine.
Yep, and COVID Check has big flags waving, so it'll be quite obvious where it is when you get over there. But yeah, it's on the corner of Argentine and 11th in Georgetown.
Okay. Well, Dr. Ryan, that's all the questions I have for you. Is there anything you want to add before we go today?
No, Mark, I would just reiterate to everyone, as I have for many months, please get vaccinated. Do yourself a favor. You will not regret it. And please wear your mask when you're out in public. Even if you are vaccinated, it will help slow and stop the spread of the virus, the likes of which we haven't seen in a very long time. So please do your part to help all of us get this over with and move on to other more important things.
Well, I'm going to keep on doing whatever you recommend, Dr. Ryan, because I know you got the great information, and I encourage everyone to do the same. Thanks for joining us today, and hopefully we'll get an opportunity to catch up again next week.
Sounds good. Thanks, Mark. Appreciate it.
Bye now.
Bye.
All right, everyone. That was Dr. Timothy Ryan with his weekly update. He's always full of great information. And so let's see. Today is Tuesday, and so that means today is testing day here in Idaho Springs, and that's going on right now as we speak. If you're listening to this after on the rebroadcast, it is Tuesdays and Thursdays from it's 10 to 2, or maybe it's 8. It's 10 to 2, and then in Georgetown now on Mondays from 10 to 2 on the corner of 11th in Argentine. And just an update on vaccines. We'll call it Vaccine Wednesday here in Clear Creek County, and that's at the brand new, spanking beautiful new medical facility that we are so privileged to have there on Minor Street. And let's see, that's from 10 a.m. to 2 p.m. And you can get a COVID. These are all free, by the way. COVID, hepatitis A, tetanus, polio, flu, vaccine, pneumonia. Oh, that's a big one. Pneumonia, especially for people my age. And that's a big one. And I wonder about measles, if they have that available. Anyway, something else that was just texted to me. The testing is not from 10 to 2. It's from 8 to 2. So there's even more opportunity. But don't forget to call ahead and make your appointment. You can do that by calling that county number. Let me pull that up one more time. Let's see. That number is COVID vaccination and information line and testing line is 303-670-7528. I think that's the number you call. Yes, it is. Okay. That's all. Let me quit before I make any mistakes other than what I've done. Here's some music, pre-recorded music for your listening enjoyment. Thanks for joining us. I'll be back on Saturday with the Morning with Mozart show. See you at 8 o'clock on Saturday. Bye.